Thank you, Sani sir.
Thank you, Sandeep ji. Thank you, Sahani sir. Thank you to the whole Hindi team. And Sahani sir, one request: when you are talking, your mic should be here because the voice was feeble when I entered. I noticed that.
Thank you. This is a good suggestion. I will do it.
Okay, thank you, sir. Now it is the time for the English session. Welcome all the participants to today's session. Today is our 1045th day. Continuously, we are conducting this webinar without any break. So I'm appreciating all the participants for your encouragement. And International Forum for Promoting Homeopathy is started with the purpose of sharing the knowledge of homeopathy all over the world and unite the homeopathic doctors together in one platform. So every day we are succeeding our mission, and we are all the participants and many doctors are supporting us to continue our journey. So thank you so much. And today's our guest is Dr.Mittapalil Narayanan. Is MD in Homeopathy, Assistant Professor in the Department of Medicine in Government Homeopathic Medical College, Kadapa. Before, he was worked as a professor in the Department of Homeopathic Medical College, Hyderabad, Telangana. Dr. Mittapalil Narayanan, sir, I'm welcoming you. I think.
Well, the topic is, can homeopathy reverses pathology to normalcy? That's the topic. So we all know that we had a lot in that way, and a lot of cases, including in such cases, the infantile uterus were brought to normalcy with our medicines that we witnessed. We have heard a lot on Ifph platform. That is the most important. Then moreover, a lot of malignancy, even the secondary, the metastatic cases also is being corrected with homeopathic medicines, because we all know that the basic thing, that means the function creates an organ. So whenever the functional aspect is encouraged or enhanced, definitely the pathology will be forced to correct itself. Because when you study about the simple substance as written by Kent, we know the potential of the simple substance to modify energy to matter. So I think it's quite natural that we can expect, yes, of course, homeopathy is capable of doing all these things. Sahani sir, what is your opinion, sir?
I think he did. Sahani sir, Manoj, Dr. Manoj was asking you something. To Dr. Sahani.
I was busy calling.
Yes, sir.
Can you repeat the question, sir?
Yes, sir. What about today's topic, sir? Can homeopathy reverses pathology to normalcy?
Yeah, this is a good question, sir.
Yes, sir. What is your opinion in the philosophical as well as practical background, sir? Please.
Opinion is mixed. Yeah, my opinion is mixed because I have the patient of the different natures, and we have to understand what is the meaning of the pathology. What I see, pathology and physiology. Physiology is the active, and pathology is the end. So where the things get ended, this is important. It is mature, and it is dependent on many factors. Okay? There are, suppose diabetes. We take the example of the diabetes. The patient is there, and we have some insulin dependent diabetes, and there are two types of the diabetes we all know. So can it be reversed? Can it be reversed? For many of the cases, I have found it has been reversed, and they are not happening. Similarly, hypothyroidism and hyperthyroidism, where the TSH level is very high, changed. Then there also I have seen that there are the patients who have been. It depends. It depends how much constitutional totality you are getting. When you are taking the pathological symptoms, it is not necessary that you concentrate only on the patient. See, suppose for all diabetes patients, for all this pathologically so-called pathological diseases, what I say, I do go to his lifestyle, life situation, his mental symptoms, mental setup, and then I get the medicines. I do not consider the rubrics like this, diabetes or all this, and I am getting the results. Yeah, I have the good results with this, with all these phenomena. So definitely, pathological conditions can be reversed to some extent, and some extent means to those extent where we can get the constitutional totality. Constitutional, if you are matched that of constitutional totality, it is. I was treating a case of a sterility, and it was said that the fallopian tube is blocked, and she will not be able to conceive anytime. And the only thing that is some transplant, something has to be done. And test tube baby type. What my wife started testing, and it was observed that this fallopian tube which was blocked, and the lady conceived, and she also got better. Why? Not because I took the understand feelings of the fallopian tube. I see why it has been. The two things are very important. Why? And then how, and what is the process?
Excuse me, sir. Sir, your voice is not clear as indicated by Dr. Ajini earlier. Yes, that's correct.
So now it is left, and you are able to listen to me?
Yes, sir.
So
Yes,
my understanding is that we have to be careful about the constitution, and constitutional totality is the medicines which comes out of the constitution. It has the capacity to be removed and change the pathological. It can to reverse the pathology. So this is possible, sir, and many cases, but it requires how much we have drawn the totality. The totality is basically dependent on the practitioner's perception, my perception, and how much I have seen, observed those phenomena. So this is very important for us.
Yes, sir. I think we can have a discussion on that. Those who would like to participate can share their experience on this aspect. This is a very important thing. When one side of the medical practice claims that these are not at all reversible, but with the dynamics medicines, a lot of such things are happening. Often we can say facts are stranger than fictions. And of course, there are a lot of cases. We are presenting the Ifph for the last 1045 days, witnessing such cases a lot. So the reversibility of pathology is the question, and it's a topic. Those who would like to participate, Dr. Veena, what is your opinion?
Can I share one of the case?
Yes, sir. Of course, we have. Yes,
there was a patient for me today. Also, he came, and he came to me in 1993, and he had an acute fissure piles problem. And then the doctor at that time, he said, you have to go for the operation. But because he was fearful of the operation, he opted for the homeopathy. And he came to me. And now he said that, he said, you treated us for about 2-3 years. And now he's completely free. He's not suffering from now he's not coming for the fissures or piles problem. He's coming from some other cough and colds, the local problems that he used to get. So after the things which was told by the doctor in 1993, and the patient is now 61 years old today, and he is still surviving without any fissures, and any problem. So this is very, this is possible. This was possible because I didn't care for the fissures. I cared for the person as an individual. This was the important thing that I did, and now he is very much free from it. Similarly, a case of cancer, hip joints cancer was there. She was an old lady, and the doctor told her that this is not going to survive for the 2 or 3 months. So what happens? I started treating, and she was brought to our clinic by carried by their family members. She was not able to walk. She was just lying on the bed, and she was brought to our clinic. And it was 1990s. It was in the 1990s. So at that time, we started treating her, and gradually she recovered. The time limit that was prescribed by the doctor that you are going to for the 2 or 3 months only, this will be solved. Uh, so that also part out. They are now they are getting some hopeful also. So gradually hope is there. And there one day he was able to come and walk properly. So with the support of the lathi, yes, he came to. I was very happy to see her. He was very happy to see her. And thereafter she came without any support also. Then one day I asked her, how much time you want to live? Doctor has given you only one or 2 months. Now you have lived for about 4 or 5 years. 4 or 5. How much more time you want? डॉक्टर साहब आप ऐसा कीजिए कि आप ये मेरे लड़के का शादी हो जाए. She wanted that I said you will not die before you get son get married. So then this also passed. Then she was expecting the grandson, and that time he also passed. And she survived. And recently she died at the age of 80. So what do you call this? It is a reversal or not? What we can say? If they would have lived in the allopathic medicine, they might not have survived. But with the grace of the homeopathy, they survived. It is still not here now.
Yes, sir. Some technical problems is there. Think. Yes. There again. I think Dr. Veena is there. Dr. Veena, are you there?
Yes, sir. Good evening,
Yes,
sir.
please proceed, Dr. Veena. Your
So-
opinion on this reversibility of pathology and your please share your experience.
So,
Guest is not join. So meanwhile we can have a discussion. Please.
Sani, sir, even I have mixed ideas about that, sir. Because pathology, reversing pathology, it depends on what miasm is involved and what kind of pathology is involved. Definitely, we are seeing cancer cases getting resolved, but I would say it needs utmost cooperation from the patient side and the patient's family. So when we start the treatment, if the patient is cooperative, when the patient becomes psoric, he will start shouting more or crying more about his disease, and he may suppress it again with some other medicines or some surgery. This also we have seen. So it is very difficult to convince the patient and patient's relatives in such cases. But having said that, if they are cooperative, I think, and the time permits, and if they have the higher lifespan, definitely the pathology is reversible. So it depends on the cooperation of the patient. This is what I think the most, and the God's grace. So the totality what we bring from the patient will only decide the medicine, and that only gives a path to cure. So the patient should understand his own body, and time and again, with reversal of pathology, he should be able to communicate with us his symptom change also. And the other side, the physician should be a very good observer to find out what is happening in the patient also. So since we don't have bedside prescriptions nowadays, it is a difficult task altogether, but still nothing is impossible in this world. So homeopathy, definitely it has got miraculous treatment arenas which should be explored by each and every homeopath. And the experienced doctors, really they are helping us in this platform by sharing their knowledge. That is a very great thing which I would appreciate, and I am grateful to. Thank you, sir.
Thank you, Dr. Veena. Dr. Ahmad Hassan, you can unmute.
Good evening. I think my video is not opening. No problem. In pathology, pathology is fortress of medicine. When we are in medical college in pathology department, so it is their teaching. In blood bank, we are discarding the first donor blood. We are testing all AIDS, hepatitis, STLV3, any cancers, all type of things before transfusion of blood. But we are discarding the first time donor. This is any protocol, because there is a window period where no laboratory test can detect the disease. So for the safety of patient, that is why our blood bank need regular donor, do not want random donors. So it is very easy to compare their donation. This is my, and in some viral cases, I observed that some, because they are my staff, they got hepatitis positive because we are lab staff, so we are screening our health staff to care the patient. So some patient, some staff without any treatment got auto reversal. It is in the viral hepatitis cases. Thank you very much.
Thank you, Dr. Sahani, sir. And now Dr. Nutan Sharma is here, right?
Yes, Dr. Ajani, I'm here only.
Okay. Say your
Yeah.
opinion about homeopathy in reverse pathology.
Definitely, this is the beauty of homeopathy, that we can reverse pathology to.
Can you open your video?
No, ma'am.
If
It's okay. Am I not so audible?
yes, sir, it's audible. Okay. Okay, continue, madam.
So, yeah. So this is the beauty of homeopathy, that we can reverse pathology to not to the normal, at least near to normal. We all know Herring's law. So one thing Dr. Veena said, that we can see all those cases in IPD only, because patients are all the time.
Excuse me, madam. The sound. Are you traveling? The sound is not that much clear.
1 second. Hello.
Okay.
Is it fine, Dr. Ajani?
Yes, audible, but not clear. Clarity is less. Okay, no problem. You can continue if you are.
No, I agree with Dr. Veena. I said that
Okay.
it is only visible in IBD cases. Like for example, we see in cases of diabetic foot, like when we do dressing, daily dressing of diabetic foot, no. So we can see the changes. So we can witness all the like pathology going to reverse order. Like in case of like neurological disorders. So by seeing Harry's law, like one case I would like to tell you that not this year, 2 years back, I had seen one patient in IBD having diabetic foot. So we used to have like dressing all the like alternate day in 2 days with echinacea, gunpowder, and few more drugs. Like we used to clean the wound. So there was no sensation in the beginning. Then slowly sensation used to, he used to feel something, he used to feel pain. Then slowly it started healing. So what is this? This is only like by seeing the Heron's law, we can conclude that the pathology is going in reverse order. So this is the beauty of homeopathy. That's what I agree with all the speakers. And I salute to Stamina, Dr. Sahani sir. He covered Hindi session and he's still he's explaining all the wonderful cases in English session also. So that's all I can say right now. Dr. Rajini, you unmute yourself.
Oh, oh, sorry, doctor. Thank you so much for your opinion.
If you permit me, I can share one of my case of the therapy and
Okay,
how I approach to that. So I'm just sharing my PPT just right now. See, now this is a case. This is the part of my lecture where I talked about the comparative study of the thyroid case. It is illustrative case. It was this case a lady, female, 40 years, 65 kg weight. The problem was, you are able to see the PPT all? Can
Yes.
you see the PPT? Yeah. So the patient was suffering from the she was diagnosed for the hypothyroidism for the last 4 years. Breathing difficulties were there, palpitations and cough exertions were there, allergic dust, and obesity was the problem. Then
Kahani sir.
yeah.
Yes, our guest is
Our guest has joined.
Let me complete for the it will take 2-3 minutes.
Okay, sir.
Father was a retired person, housewife, and this is the history. Then mental setup. This is the mental setup. I am not going to, and these are the physical symptoms that is observed in that. And the rubrics that I selected: mind, bed remains in desire, memory weakness proper for, mind changes desire, stomach nausea aggravate, palpitations exertion during, chest palpitations cough during, respiration difficult cough during, respiration difficult and general hypertension. The TSH was, you see the TSH level. The choice of the remedy was Palsetla. It was prescribed in you by 1 potency and you see it became completely. So this is the repertorial totality. I wanted only to share that this is possible and the patient is still okay and she is happy with this our method. So I'm not going to take time. I will let our speakers today speak. Dr. Narayana, you are here.
Yes, sir. He has joined.
But the audio is not connected. The problem is audio is not connected.
Oh.
Dr. Narayana, could you please rejoin so you can audio maybe connected? It's not. He's in the participant list, but the audio is not connected.
I made him as a co-host.
Yes, he's the co-host now, but the audio is not connected.
Okay, doc. Yes, no.
Yes, this is always need some sort of technical skill, also always experience. The Zoom sessions are always highly demanding all these things.
Dr. Narayana, Dr. Narayana.
And video, even the video is off. Dr. Narayanan. I'll send him. Dr. Manoj, can you call him again and say?
Yes,
that will be nice.
Yes, of course, shall call him. These are a kind of pathology in Zoom sessions. Zoom, we can say it is Zoom pathology.
Zoom pathology. No, not Zoom pathology. Narayana, you is able to listen after or not?
Dr. Badran has raised his hand. Dr. Badran. You can unmute yourself and say your opinion.
Dr. Narayana is out of the room or?
Regarding this issue. I have heard many cases of cases by complex medicines, especially for inguinal hernia, inguinal scrotal hernia, even of children, even of infants also. umbilical hernias, ganglionic cysts, pilonidal sinuses, fissure nano, fistulas, lymphadenitis multiple, including intra-abdominal. Weight loss, loose teeth. Homeopathy medicine is very good to strengthen the teeth which gets loose due to gum disease, inflammation of gums, etc. Phimosis can be well corrected by homeopathic medicine, and manure, which I have shown to all earlier. It is very simple, I think. Well, it can be done by everybody. It can be done simply by dilating the profuse tip by thermometer and both ends of the thermometer, and within 2 weeks it will be okay. Then for undescended touches also I have given medicines with very good results. Also for omphalitis, inflammation of umbilicus, when styes in case of eye disease, styes and pterygium. Pterygium responds well to homeopathic medicine and will be cured, I think, within 2 or 3 weeks. That's my experience in this. Any question shall be raised, can be answered. Thank you.
Thank you, Dr. Badran. I think our guest has joined again.
Time, how much time is left? Now it is only half an hour left.
Yeah. Now we have only half an hour, though, so there is no questionnaire if we started the class. I think he left again.
He's again trying, but not
Not
able
getting.
to connect properly.
Okay.
Previously, before starting the Hindi session, we have enough time to make these adjustments. But now it's just after just following the Hindi session, it's not possible now. That is the main problem recently. Otherwise, we are always conducting some trial before starting the session at 8 o'clock. That's the problem. Moreover, he's the first time in this session.
Oh, he's for the first time, because he had a talk with me.
Yes.
He had asked me, sir, how to join. I think 1 month back, he asked about me. I said, you just talk to the Dr. Narayanan. So I gave the number, I told him that.
So, sir, I think it is better to avoid your headphones, sir. That is so that we can clearly hear you.
Yeah, I think that is the reason.
Yeah.
Otherwise, when you are talking during the session, it is more clear.
It's possible, huh? Yeah.
Yes, sir. How is that now, sir?
I think that
Unfortunately, our guest is not able to join with mic.
Ajni is the host, so I think that if there is any difficulty from your part, please check it.
She's already made him co-host. So there is no problem.
It's caused, but not connected. I think Wi-Fi, while we are entering into the Zoom, it shows Wi-Fi. It's written something writing there. No, we have to click on that. Maybe that is the.
He's not able to open it. This is the problem.
I don't know what is the reason.
I think we can continue our discussions.
Yeah.
We can have a session later. Okay.
Please.
I shall inform you. No problem.
Okay.
Please continue, sir. Yes, sir.
If time is allowed, I shall explain.
Yes, sir.
cases that has been cured by
Yeah,
fungal
Sahani
medicines.
sir was presenting his case that time. Dr. Nar. Oh, now also it's okay.
Yes, I think you can make an arrangement who is to present, either Sahani sir or Padran doctor.
Okay, sir. Sahani sir,
Yeah,
you can continue, I think.
I think that clinical cases of the therapy I can do it. Huh?
Sir, Sahani sir, please continue, sir.
Okay.
Yes, sir.
Yes,
Sahani sir is trying to share his video.
yes, that's good. Okay.
So I'm back to the same case, the Falsetla case. This is the follow-up things that we did. People started taking the. This is the progress report. TSH came down to 5.05, 5 came down to 2.5. Then it came down to 1.05, and it was followed for the 2 years with this steady maintenance of the cases. So this is wonderful things that happened only with single medicines of the Falsetla. You can see that I'm giving you another. There are some of the. This is the general. We select the medicines from the general pool of homeopathic medicines on the constitutional selection, and number of cases that I took. So Falsetla 1 case, Metronidazole 4 cases, Silesia cases, Tuberculinum 2 cases, Sulfur 2 cases, Metformica. So this is my research report that I had submitted. This is a summary of this. So these medicines were indicated on the basis of the totality. I will show you the repertorial chart, not in the full detail case, but only the repertorial chart of these patients. Now see, this is the Netramure case, the first one. And the rubrics that I took was mind, grief, silence, mind introspections, mind weeping easily, general food, fish desire, fasting amulets, and face was greasy looking, and external thyroid gland was there, and music amulets. The Netramure medicine. That the treatment period was 6 months. This is another case of the Netramure. See that. So what is the changes in the symptom? What this patient is Netramure I prescribed on this totality, and this patient I prescribed on this totality, where the thyroid general, then hypothyroidism, anger easily, fear ghost, consolation amulet, the face swelling, coffee, and then cold heat aggravates, then sensitive desire for the cheese and obesity. This is another case of the Netramure. So the 2 different cases of the Netramure, having the 2 different types of the totality, and without any and they responded. It took 15 months. This case was 16 months. You are able to listen, madam?
Yes, sir, but I don't know what happened. I can hear your sound, but it is not clear that much. I don't know, maybe some other difficulty.
The problem is that now the rain is here. Too much.
Yeah,
rain
maybe
is going.
because of that.
So I'm trying to again put my head. But let me see. So now another case of the Netramure. Now this is the case of Silesia, and see the patient picture. Affectionate, consolation aggravate, swelling, coffee.
ഇങ്ങനെ വെക്കുക അല്ല കിഴി ഇങ്ങനെ കറക്കി കറക്കി ആ കിഴി വെക്കുന്നത്.
What type of the voice it is coming? So this is the Silesia. Then another, it was 16 months. Then Silesia, another case, swelling, fear, poverty of, anxiety, in every case, I take the mental symptoms, and this was able to decide the. This is the totality percentage. The portrait patient is the silesia, but the different they are coming with a different disguise. So this under this different disguises, we have to find out that individual medicine. This is the another case of the silesia. So,
Sir,
yeah.
He has joined with the mic. Can we invite him?
Yeah, just
Dr. Narayan.
Tuberculinum, then sulfur. So these are the things that I have tried to give you. The results were completely cured case were 11, moderate 3, and there was only one patient who really responded. So I will not go into the details and let Dr. Narayana speak for some time.
Dr.
Dr.
Narayan.
Narayana, you are here.
Yes, he has joined with them. Dr. Narayan, please. Please unmute yourself.
Okay, madam.
And your video also, sir.
Video also.
Yes, sir, we have to see.
Video, start video, no?
Yeah.
Okay, madam.
Okay. Thank you, sir.
Now we can see you, Narayana.
Yes, sir. Sir, good evening, sir. Pranam.
Good evening, but I am very angry with you, sir.
Yes, sir.
I am very angry with you because you have joined late. But
What?
We
Why
all are
angry,
waiting
sir?
for you, sir.
You have
Yes,
been waiting
madam.
for you there.
More than
That's why I
40
am
minutes.
angry with you.
Okay.
Okay, you start.
Okay, you can start now. Because we
don't have the time. Only 20 minutes you have to cover. Only 20
Yes,
minutes is left now. Yeah, start right now.
20 minutes.
Yeah, only 20
Sir.
minutes left for you.
20 minutes, sir.
Dr. Narayanan, we have English
yes,
session
madam.
from 8 to 9. Now it's already in 8:45.
8 to 9.
8
Madam,
to
9 to 10, madam.
That
8
was
to
the
9.
Malayalam session.
That is
8 to
Malayalam.
9.
Malayalam.
Yeah.
Okay, sorry. It's okay, sir. Maybe
Okay, sir.
understanding
I
will
will
happen.
start
Now
now.
you can
I will start
talk for
now.
20 minutes. Okay.
Yes, madam. So first, sterility in 2 men. That is one is related with the months complicated with the sterility. The person suffering with azoospermia, and on that basis, I have been selected that pulsatilla 30, 1 dose, and SL for 15 days, and after 15 days, he has advised to take lab diagnosis, where he got 50% of this sperm count increase. Already as under treatment of allopers, where they are always showing 0 sperms, and after giving that pulsatilla on the basis of this causation, he got full sperm count, and after 1.5 months, his wife become pregnant, and he lived the my case, and after 1.5 months, he came and told that my wife is pregnant. There is no need of taking treatment, madam. Second one is the sterility because of the masturbation, and also suppression of that ejaculation while ejaculating by pressing glans penis. He is a student, PG student. Because of that, he got moderate atrophy of the testicles, and we, with our guru surgeon, we performed that biopsy of the testicles. Moderate atrophy is there, And after that, on the basis of suppressed emotions, we prescribed Staphysagria 1M, and he got somewhat benefited. But after that, by repatrializing, atrophy of the testicles by suppressed emotions. After he developed autoimmune disorder, which leads to moderate atrophy, we prescribed thyroidinum 200. After that, he got the full sperm count within 3 months, madam. Now he is father of 2 children, 10 years. And the second one, next one, cancer, cervical cancer treated in Swims, Tirupati. My student mother, who is suffering after effects of the hysterectomy, and he came to me and explained off case, that is his suppressed emotions. I prescribed Staphysagria 1M, but she always presenting that I am not relieved but half relieved. After that, I took the case fully, where he has cousin sister's daughter. Since his childhood, under his presentation, that she has fall with love other caste fellow, and the child mother scold her that you don't know what is happening, you are not observing the child. That's why he depressed and got this cancer. So I prescribed 10 mg 1 dose of phosphoric acid, and he is very attached to the child, and he can't bear the any mortification. So he sent that girl, and because of that attached and the girl away from her, he developed that the cancer. So 10 mg 1 dose. After that, the Swims Tirupati gave the result, lab diagnosis, nil significant, madam. And other 2 asthma patients. One is child suffering with 1.5-year-old, and the pediatrician treating for 1.5 year, 6 months without any relief. And the patient came to me with high fever with respiratory infection. I gave medicine many without any case taking by the patient's parents. Does not able to reveal what happened. Later, I observed the patient after 3-4 days, high fever, asked the child mother to put him breast. While putting breast, the child used to drag the lower part of the chest, that is PQRS of the antidote in the respiratory disorder, where the phlegm is fully loaded with the, in the lungs. And I gave antidote 200 watery dose. Within a minute, he got relieved, and after 1 week, I put him under SL. After 1.5 months, he has a history of psychotic, skin eruptions during 6 months of age. So to relieve the obstacle, I gave him that child Tuja 31 dose. After that, he completely relieved. Since his treatment Now he doesn't went to any doctor till now. Now he's 20 years old, madam. Next, another case suffering with a 2 years old child. When I was working as a house surgeon in the peripheral duty, he is suffering with same condition. When I was treating, observing these OP patients, he came into the OP that with wheezings and bronchi from distance. So I took that peculiarity and gave that antidote. 3 days after, he relieved and permanently cured, madam. So mainly I am giving on the basis of peculiar symptoms, PQRS, and on the basis of mental symptoms. Next one, a case of left heart failure. He has been taking medicines from the allopathic doctor nearby city, and after that he refused to take that medicines for 3 days, and he developed totally unable to move and talk. My student, one of the student told that he is suffering with right heart failure. But after hearing his case by phone by my student, I asked him to bring the patient. When he came to my clinic, and I observed that he is suffering with left heart failure, and the report also shows that he is suffering with left heart failure and unable to talk or move even hand also. I asked the attendants what happened. Is any mental agony since few days or 1 month? And they told that he has a problem of this lack of money and to sell his deeds, and also is previously suffering with tuberculosis. So on that basis, there is no time to refer the case, and on that I come to the conclusion is tuberculosis, and I prescribed 30 calcare carb 1 dose in watery doses. I told them he will get up and sit in the auto within 10 minutes, but within 5 minutes he sat in the auto and they went there. After that, I prescribed SL for at least 5 months. After echocardiography, they shows the normal condition of the patient. So next case is same. He is suffering with heart black with ejection factor 22%, and also is since childhood is tubercular tubercular miasm is his history with his father and others. I collected later and shows that he is suffering with tubercular miasm, and he is suffering with that heart black, and went for surgery for this pacemaker, where he afraid to perform that operation in the hospital, and he went run away. After that, he met with me, and I prescribed same. Previously, I thought that without taking case 6% this hemoglobin is there. On this basis, I prescribed ferrum fast, but there is no relief. After taking all the case from his father, I prescribed that calcare carb 30. So after 6 months, he got relieved and he is feeling well. that ejection factor also increased up to 25-27%. Leading well, madam. And other cases, more than 10, I treated this typhoid, madam, where I took only one medicine by referring the different books because I failed in treating the first first of my practice in early stages. After that, I referred a repertory and found that in advanced stages of third stage and fourth stage of typhoid, where there is 160 dilutions or 320 dilutions, arsenicol is the remedy. In the early stages, brain is the remedy, but in advanced stages, arsenicol is the remedy. I prescribed all the patients 30 repeated doses TAD for 5 days. After that, I advised them to take any type of food without any complications, without any convalescence period, just like allopathy. So this shows homeopathy works fast and speed. And my own case, my mother's case, first I have treated the acute case. She is suffering with prolapse of the uterus leading to hydronephrosis right and with perinephric abscess, where I treated at that time the endemic disease is malaria. I treated all the patients with different medicines, but my mother didn't responded, and I observed that something is wrong. After that, we went for ESD abdomen, where we'll find this diagnosis. After that, I prescribed according to the Richard Hughes pathological this one, many medicines, but there is no relief. After observing 3 days, his mental symptoms and his relation with family persons and fear of death, I select and went to Kent's repertory, where I find 4 drugs, among them Silesia, Metsal, Heparsal, and least one is that arsenicol, 3rd grade. But his our symptoms reveals that mental symptoms reveals that he is totally belongs to arsenicol, where I prescribed 6 potency in water TAD for 3 days. After 3rd day, the patient is well. My mother said, there is no swelling or fever, and I am well. So first case, I treated acute case by mother, and later I took all these cases. Now I am very proud of homeopathy by diagnosis and proper case taking, especially mental and pathological conditions, by going through diagnostic aspect, because I am completed my MD medicine, and also I worked under my guru, gold medalist, Dr. Nagarna in MS. So helped a lot and treated these cases. I am very happy. So most of the people, wherever we go, we degrade ourselves as a homeopath because we don't have knowledge of diagnosis. Wherever we go, we degrade ourselves, and we won't admit ourselves to the allopathic doctors, because I have many my professors and friends are rapport with the allopathic doctors, and my teachers also, most of the teachers are allopathic doctors and professors. So I have rapport with them and learned well. So I am very proud of homeopathy. Previously, I am joined in homeopathy. I thought, how can I treat the patients without MBBS? But after treating my own mother, within 3 days, complicated. My teacher also said, how can, well and good, he said. But for the treatment of my mother, they are advised right nephrectomy with left also hydronephrosis. So he can't survive. So
Thank you, sir. Thank you so much. Now it is the time for the Malayalam session. Normally,
okay, madam,
as you said, the kind of integration, as you have mentioned that you have rapport with the allopathic doctors. We are treating different system, but we should have integration with each other.
yes, madam.
That is needed, but unfortunately, it is not happening. Even though I am moving to Malayalam session, we will discuss.
No, madam. In North India, they have rapport with
maybe.
allopathic doctors. They are
Maybe.
very well research institutes are opened and they have rapport with us. Only in South India, we don't have that rapport with allopathic doctors,
like
madam.
maybe.
So we have to
Thank
develop
you.
like that. North India,
Yeah.
my teacher, Sani sir, and others, they will have very rapport. Dr. SM
Thank
Singh
you
sir,
so much.
Allahabad.
Thank you so much. I think we will have another session. We need another
Madam.
session from you, sir. Dr. Narayanan. Now it is the time for the Malayalam session. 9 o'clock.
Okay, madam.
I am inviting Dr. Hubert for
Thank you, madam.
moderating. Thank you. Thank you on behalf of Ifph and from all participants. Thank you so much, and see you again. And thank you, sir. And I am inviting Dr. Hubert for moderating Malayalam session. Dr. Hubert, please.
Thank you. Can you hear me?
Yes, yes.
Okay. Dr. Narayanan, sir. It was a very, even though it was a short presentation, but it was a great one. Thank you, sir, for different subjects you have already shown us. That we are very much grateful to you. You come another day with all your weapons. Thank you, sir.
Yes, sir. We have our representative in WHO. Even then, they have not representing our system about our system there, sir.
Thank
Previously,
you, sir.
I saw that Peter Fisher is there. He died, I think. Now who is there? I don't know.
Thank you, sir.
Thank you,
sir. Okay.
Okay.